Welcome, everyone. I'm Dr. Basil Considine, and I'm here from the ACU Online Writing Center for Writing as a Nurse Tips for DNP Students. If you are new to the ACU Online Writing Center, we work with students at any point in the process. You can come to a webinar like this. You can submit a paper for feedback. You can request a phone or Zoom appointment to ask questions in real time. We're happy to work with you at any stage of your writing. You don't need to have a complete draft. You could be brainstorming, trying to understand the assignment instructions, or have a page or two or 10. We work with students primarily through asynchronous appointments, meaning you schedule an appointment, you upload your paper by the time that appointment slot comes around, and then we send you feedback via email, generally within 24 hours. If this was, say, Memorial Day weekend, it might take a little bit longer just because of the holiday, but we do try and get everything back in time so that you are able to use the feedback before you have to submit your paper. Phone and Zoom appointments are available by request. We are generally able to uh, meet requests for a phone or Zoom appointment, so long as it's not in the very final week of the term. So if you wanted to just ask a whole lot of questions and resolve some concerns or uncertainties, week 1, week 2, week 3, all the way through week 6, we can probably work you in. It is helpful to send us a range of times when you are available, but we're usually able to work that out. We also have a large number of resources on the Online Writing Center website, which if you stay for an hour after this, we have our Introduction to Graduate Writing webinar right after this, where we'll show some more resources. There are, among other things, a course paper templates and dissertation and doctoral study templates that you can use to save a lot of time on the formatting, as well as sample papers and other resources. Again, the basic format for getting feedback on a paper is to schedule an appointment using the WC Online scheduling system. By the time that appointment slot rolls around, go ahead and upload your paper to Canvas for us to look at, and then we send you feedback within 24 hours. Some upcoming webinars that you might be interested. Right after this, we have Introduction to Graduate Writing in APA Style. Starting on Tuesday at 6 p.m., we have a dedicated 1-hour Intro to APA 7th edition webinar. And then we have we have coming up on Tuesday, the 11th, we have Writing as a Nurse, Annotated Bibliographies and Synthesis. The week after that, we have another new webinar in the Writing as a Nurse series, Evidence-Based Practice, followed by, on the 8th, the methodology paper. Now, you are welcome to come to any webinar that interests you. You're not required to be in that class. And in fact, we have a lot of students who want to know what's coming ahead and to kind of be around, to acculturate, to slowly assimilate and absorb different ideas and methods. And so they come and RSVP for webinars that they're going to take the class in the next term, or they just want to look ahead to the doctoral project. We have a large and growing body of related webinars. You have listed here the webinar titles and the courses that they tie into. If you go to the Writing Center webinar page, you'll find that these are tagged with it. So if, for example, you were taking Nursing 612, I'd say, oh, you probably want to look at our Pico questions webinar, that because there's an assignment that you will be doing shortly that involves exactly that thing. These are all listed on the Writing Center webinar page. You can see the link at the top. I'm going to go ahead and type that in the chat room for you. And if you are attending a webinar that you haven't RSVP'd for it, and you would like to get a copy of the slide deck that includes these links and many other things, just type your email address in the chat room and we're happy to add you to that list. Anyone who RSVPs for a webinar will automatically get a copy of the slide deck and a link to the recording after we have those posted, generally the same evening. And so you can RSVP for a webinar where you know you have a conflict and you have to leave part way through, or even that you're not able to attend, but you are planning on watching it later. So that's certainly an option that many of our students use. Some things you'll hear me referring to in the next hour. I'll be talking about our APA course paper template, which does a lot of the formatting for you. We have a YouTube channel, which is a convenient way of accessing our webinar recordings. And we have a growing body of posts on special topics on the Online Writing Center blog. With that, let's talk about our main objectives for this evening. Our two learning objectives. We want to understand the differences between the professional writing that you do on the job as a nurse and the scholarly or academic writing that you'll be doing as a student in our programs here at ACU. And then we'll also talk about how to develop writing and planning habits that complement your schedule. One thing that's very helpful to know as a student starting in the program, whether you are in our BSN to DNP program, whether you are in MSN student right now, or you are at the Doctor of Nursing practice stage, how you write on the job as a practicing nurse tends to be very different than how you write most of your graduate papers. And the more clearly that you can understand the differences between these two contexts and the expectations, the easier it is to code switch and tell the right things to the right audience. Now, I did my doctoral dissertation research on an island in the southern Indian Ocean called Mauritius. Mauritius was settled by French settlers from Brittany in the 17th century. And because of this, there is kind of a 17th, 18th century dialect of French that is spoken there to this day with its own little accent. Now, I learned French in the Boston area, so it had more of a Quebecois accent. And then I went to Paris and I learned the Parisian accent, and I learned the Mauritian accent while I was there. What would often happen is I would meet someone and I would say hello in French, and then based on how they responded, I would switch into that dialect and that accent. And often people would say, "Oh, sorry, I didn't hear you right." But what was actually happening is that I was waiting till I heard their response, and then I could code switch into what I knew that they were familiar with based on the first sentence that they said. And I mentioned this as an example because when I first arrived in Mauritius, it was really hard to do that. But after I'd been there for a month, it was second nature. I wouldn't even think about it. I'd just say a hello, and then as soon as I heard the response, the change would happen. And although it may seem like a lot when you're starting a new program, it is something that gets much easier just because you're doing it more. And we're all used to getting better at the things that we do a lot. We're going to talk about the writing and planning habits that you can develop to work with your schedule, because there are some particular constraints that apply to DNP students that aren't necessarily as common with some of our other programs. Most DNP students that I know work a bit more than full-time. When I've done surveys of this, they've usually been working 60 to 70 hours per week while being a full-time student. And it's very common to be pulling doubles. You know, you've got some seniority, you're covering for people who are out, and other facets. And those are great. It's good to help out colleagues. It's good to have the money, but they're also mentally and physically draining. And if you're doing a schedule like 3 on, 4 off, it's easy to get in a kind of feast or famine type pattern for studying that can lead to rushing your coursework. And just as we know with medication administration, rushing makes it more likely that you will make mistakes. So you want to have a process. You want to, just as you would observe the 7 rights, you want to make sure that you are doing your own process justice and that you are maximizing your ability to get full credit. Also, I think it's very helpful to keep in mind that we naturally get better at the things that we do all the time. Whatever our field is, our most common writing style usually becomes our default. For some people, that's texting. For other people, that is writing memos or sending emails, especially these days. Emails are often just the opening salvo of a conversation, and you might expect that you'll have a lot of time and a lot of replies to develop all the details. Or for nurses, filling out charts. Now, we do recommend that just like when you started a new job, you're usually not going to be totally redoing the patient intake form or basic charting. You don't want to recreate the wheel unnecessarily. Well, it happens that we have a pre-formatted APA course paper template that I developed that you can download using this link. It will save a lot of time with the formatting. It will help your writing look more professional right out the gate, and it will help acculturate your eyes to what things are supposed to look like. All right, that preamble done, let's dive into understanding the differences between professional writing as a nurse and the scholarly academic writing that you're going to be doing as a student. Now, it's been a long time since my first tour of the wards, but when you're writing as a nurse on the ward, there's some things that I have just stayed absolutely true from that first time to present. You have frequent interruptions. You tend to use shorthand notes, and you're surrounded by coworkers who have a common core of experience and training. And because of that, they can connect the dots. They can interpret the notes and fill in the gaps. Why? Because we're all doing the same kind of thing. We're schooled to use the same abbreviations, and we know what kind of things go with these different procedures and medications. And because of that, there's a lot of context-driven specificity. For example, there are some synonyms that often get used to describe symptoms like pain because the patients just tend to respond more clearly to those. And we also know that when you're filling out paperwork for insurance, you need to use very specific language, like making sure that you're specifying the correct name for the drug. Don't mix up the brand name of the generic because most of the time the insurance company will only reimburse one. Now, as it happens, there's a specialized resource that I developed working for another university that goes into this topic in greater depth than we have now. I strongly recommend taking 10 minutes to read through it. It has a lot of examples about how you might adapt your language between the two different styles. But when you're adapting the writing style that you're using, it's helpful to keep in mind who is your audience. Or to put it another way, who are they and what is their background? And what kind of things do you need to explain versus what kind of things can you just tell them? Now, when you're writing as a practicing nurse, your audience is usually the next nurse. Sometimes it's a pharmacist, sometimes it's a physician, but usually it's the next nurse. Now, when you're writing as a graduate level nursing student, you're usually writing for a more general audience that does not necessarily have a specific background in nursing. And because of that, this audience needs written out explanations about what things mean, how the information connects, and other things that you instinctively know from your training as a nurse. I'm reminded of one time when I was working with a DNP student who had grown up in East Africa. And he was telling me about how different patients were responding to different food. He was working on a doctoral project about diabetes 2 mitigation. And we were talking, and he said, oh, yes, so in my country, all of the food it tends to have a very high carb factor. I said, oh, does it use fufu flour? And he said, yes. Wait, how do you know about that? And he explained to me that his professors, none of them knew what fufu flour was. And it happened that my experience, I would buy it and use it in my cooking because of my own experience living in that part of the world. So that was a case where I didn't need that explanation, but writing for the more general audience that did not have that specific background, that the cultural and culinary background, you needed to explain what it was. And if you're curious, fufu flour is made from a type of bananas that are more in common with what we call plantains in this country. So it's a very versatile, starchy flour, but also something that can lead to a very high glycemic index very quickly. So let's talk about some examples here. Okay, say the patient has a blood pressure of 190 over 130. Now, if you present this information to a hospital administrator from a business background, they're likely to come back to you with the question like, what does that mean? Is that important? Now, if you're going to give that to a nurse, you'd say, oh, it looks like this patient is having a hypertensive crisis and needs immediate medical attention. So different audiences need to know different things. There will be some cases in the nursing programs where the assignment instructions will say, this is who your audience is. And so you'll be able to leave out some things. But in general, most assignments, you'll be writing for that specific audience that doesn't have a background in nursing. And so we need to explain some things. So here's the question. If the patient has that blood pressure, how would you write it down? Well, on a chart, you might write 190 over 130 or 190/130 mmHg, millimeters of mercury. Or if we're writing instead in a graduate paper, you might write it down more narratively. The patient had a blood pressure of 190 over 130 millimeters of mercury. Or add some interpretation as we would if you're just listing, oh, here are all the stats, you might use the first. But if you're explaining why something was done or needed to be done, well, we need to explain why. The patient had a blood pressure of 190 over 130 millimeters of mercury, which is dangerously high. And not just say it's dangerously high, but show how you know that. In this case, with a supporting citation, CDC, N period, D period. If you're wondering what N period, D period is, that's for an abbreviation for the Latin phrase non datum, which basically means no date. So if you're using a website that doesn't have a date posted, you just put N period, D period instead of the year. Here's another example where you might be writing for slightly different context, like to justify an action taken. The patient's systolic blood pressure of 190 millimeters of mercury required immediate medical attention per ANA guidelines, Smith 2018. So the lesson here is that knowing your audience helps you know what you can and should leave out. Now, a big difference between writing as a graduate nursing student and writing as an undergraduate nursing student is that a lot of the undergraduate assignments are designed to teach you key history about the field, advocating for yourself and your discipline on the job, and things like that. And so they want to make sure you know things like Florence Nightingale and the birth of modern nursing, some key nursing factors in the United States, figures, and so forth. But that's for those more introductory classes. Unless specifically required to in assignment, you don't want to be giving a sweeping history lesson when you're taking a graduate level nursing course. For one thing, your classmates will tend to have already had that education. And also, the purpose of the assignment is not to check whether you know that thing, it's to focus more on a specific task. Now, specifying your context, specifying what you're trying to do allows you to keep your paper compact and focused. And so if you're giving a snapshot version, a quick one-sentence summary of what you're doing, a sentence like, this project is specifically designed to implement an intervention at a US-based medical center. That gives us a lot of stuff in a compact and easy to understand format. We know that there's an intervention. We know it's being done in the United States. We know that it's happening in the more formal environment of a medical center, as opposed to, say, a community health clinic or in a house call or anything like that. So there's some general tips about writing at the graduate level and writing as a nurse that I'm going to run through here. You don't have to copy those down. Again, if you RSVP'd or if you want to type your email address in the chat room, you'll get a copy of the slide deck. And we'll go through all of these in more detail. But the first tip is to be specific. Second, write clear, evidence-based arguments. Identify the sources of all information that you present. Ground your arguments with sources as much as possible. Don't rely on so-called common knowledge. You want to indicate how you know something, which will sometimes be saying, oh, in my X years of experience, and oftentimes it will be referring to specific sources that you cite. Make sure your reader is told why you are discussing things. Use the form and structure of your writing to organize information. Use logical bridges to connect different sentences in a paragraph. More on those later. Plan out these connections in advance by making an outline. And make sure to follow APA's specific formatting guidelines. And again, if you stay for the next hour after this webinar, we have our Introduction to Graduate Writing in APA webinar, which will introduce you to some of the principles of APA style. And then we have a more lengthy 1-hour dedicated APA webinar on Tuesday. If you're unable to stay or meet us at that other time, that's okay. We have recordings of these webinars that are available on the Writing Center website and our YouTube channel, so you can watch those anytime you want. Let's go through those in detail one by one. So being specific. What do I mean by that? I mean, we want to leave out distracting details. What's a distracting detail? Anything that takes attention away from the intended focus of the sentence. Now, I bet that at some point in your life, you've been at a party or social event where someone starts telling you a story and it goes off in all sorts of tangents. Now, it's not that it's not that those tangents aren't important to the person who's saying it, and it's not that they are necessarily entirely unrelated, but if you have too many tangents, you lose track of what you're trying to focus on. So these things that are not necessary for the argument, but distract from it, are what we call distracting details. Another way to be specific is to make sure that you're using consistent terminology when referring to the same thing. And this is something that if you are coming from a different background and transitioning into nursing, or you are doing writing after a break away from academic writing, and you're thinking, but wait, I remember when I was an undergrad, they told me to use variety. Well, that depends on your writing style. In APA style, which emphasizes precision, conciseness, and clarity, using the same term to refer to something may be a little bit boring and not what you would do in poetry, but it is very clear about what you are referring to. And that's a good thing in a medical setting where grabbing something that's similar but not the same can have very different results. All right. You also want to use the terminology and phrasing from your assignment prompts. So it's clear that you are doing the things that are saying to do, and it's clear when you're identifying specific details that they say to include. All right. Writing clear evidence-based arguments. What does that mean? First, it means that you're spelling out your logic-based reasoning. This is something that some students have trouble with because of some of the literature that they read. If you are reading a scholarly article in a European journal, there's often a aesthetic decision of sorts, where one of my colleagues from France described it as that he would not insult his readers' minds by connecting the dots. That is how that particular style of writing he was engaged in, what I call academic French writing. But that's not the same as what APA does. APA says, okay, because it's possible that someone else might come to a different conclusion than you, let's spell everything out. You also want to avoid emotional and colorful language and subjective word choices. A very common one is the adverb unfortunately. Some of the things that you relay may indeed be unfortunate, but whether it's fortunate or not is a subjective determination, and we want to avoid subjectivity and err on the side of being objective, and to avoid emotional and colorful language that may distract from that appearance of objectivity. You also want to state clearly how things are known, whether you're relaying someone else's claim or you're explaining how you came to this belief. And you want to avoid statements like diabetes is a terrible epidemic sweeping through American living rooms, leaving tears in its wake. It's probably true. Diabetes is terrible. And I'm sure that there are lots of tears at funerals and other related events. But compared to diabetes is a worldwide public health problem that imposes a significant cost and healthcare burden in both developed and developing countries, CDC 2019. The second statement is more specific about the context. It's describing something that affects the whole world, both developed and developing countries. And it focuses on two aspects: that it has that significant cost and a healthcare burden. Great. All right. What about identifying the sources of all information? Well, this is related to the last example. We want to use citations to identify the source if it's a published source. Published in this case, meaning someone else can retrieve or access it. If it was a television broadcast, well, those are archived and often made available online. Is it a website? Yeah, you can access that. If it's a book or an article in a scholarly journal or newspaper, yeah, those all count as published sources, so we should have citations for them. You also want to refer to things that were said or done rather than simply stating a fact. So an example of referring to things that were said, the patient described his pain level as 10 out of 10. And then when you're referring to your own professional observations, which does come up in a fair number of assignments, you want to make sure that you are explicitly identifying those professional observations in their context, such as, during my 15 years as a NICU nurse, I've observed. All right, grounding your arguments with sources. So when you're presenting facts, you want to include one or more citations as a sentence where you're presenting those facts. Usually one is enough, but if your claim is that several sources show this, or several studies have found that, it would generally help your argument to show that there are, in fact, several studies by including the citations for them. Now, in general, one citation is enough for most points, but like that example involving saying several studies show this or found this, if it's a claim that requires additional backing, usually you don't need more than 3. And do make sure, if you're describing something as being a current or active issue, that you're using recent sources for that. Let's talk about common knowledge. So common knowledge assumes there are things that you just know. And the problem is that other people may disagree on some of those things or genuinely not know them themselves. So what you should do in APA style is make sure that there's always a clear basis or source for all the facts that you present. You also want to make sure that your reader is told why you are discussing things. And you do this in part with your structure. by starting each paragraph with a clear unifying topic sentence, making sure that you develop that claim or develop the information that you presented in that topic sentence by adding evidence and argumentation, analysis, and synthesis, which, by the way, not only will be talking about that in the next webinar, but we also have a dedicated analysis and synthesis webinar that you can watch on the Writing Center website and YouTube channel. All right, using the form and structure of your writing to organize information. So this is one of those things where, depending on your prior academic experiences, you may be used to just writing things down and leaving that. Well, in APA style, and indeed when you're following any sort of nursing or medical procedure, you want to make sure that you are managing that flow of information. In this case, in your writing, you want to make sure that you only give information when there's a clear need in this argument for it to be given there. You want to anticipate and answer readers' likely questions as they arise. And you also want to make sure, especially for longer papers, that your introductions include a couple sentences or a paragraph outlining the major sections of your paper, so your reader isn't surprised by what you discuss and when. And make sure that the outline sentences, when you say, this paper includes a discussion of X, Y, and Z, that you then discuss them in that order, X, Y, and Z. Otherwise, it's just confusing. You also want to use logical bridges to connect different sentences in a paragraph. Now, what's a logical bridge? I'm glad you asked. Logical bridge is a set of short connecting words or phrases that tell your reader how the information in different sentences relate to each other. For example, if you use however, comma, you're indicating that what comes after that contrasts with something that's been stated before. If you're using a logical bridge like as a result, comma, you're indicating causality, that one thing has led to another thing happening. So if you get a comment from one of your professors saying the flow needs improvement, usually one of the things they're noting is that your text doesn't have a lot of logical bridges, and so they can't see how the different ideas connect. And so adding these short connecting phrases can really help show how one idea flows into another. Outlining, I think we all understand the concept of outlining, but let me try and sell you on using outlining as a regular part of your preparing an assignment. Because outlines tell you what you need to write when, and they allow you to work very efficiently in small incremental chunks, even when you're being frequently interrupted or feeling brain dead. I have a lot of students who have graduated and gone on to do great things, who've shared stories with what they were doing while working on their doctoral project. And, I've had everything from new mothers with small children, which is about as aggressive a sleep deprivation measure as I've ever encountered. Had people who were working on their manuscript at athletic games. And I should quickly add that they told me that this was while their child was on the bench and not when they were actively playing on the field. But you get the idea. There's a lot of distractions, and when your attention goes somewhere else, it just goes. And outlines also help you stop from writing sentences that you don't need, which is a very common phenomenon. When you're working late, you're not thinking straight because you're very tired. And so you just start writing more and more on the topic. And because you don't need it, it ends up diluting your argument and takes up space. Most of your papers are designed to be on the shorter side because we know how busy you are. And it just generally does not help clarify what you're trying to convince the reader of. So outlining helps you stay on the path, stay on plan. It also allows you to put in placeholders and not get stuck or stalled out when you run into something where you need to do additional research, like reading a source or finding a source. You can always just put a note And I would use a highlighter tool to mark it. Say, okay, I'm coming back here. I know I need a supporting source for this claim, but I can't remember which one it was right now. So I'm highlighting it, and then I'll go back later and replace all the highlighted stuff with the things I've double checked with my sources. So for planning this out in advance, I strongly recommend that you use the assignment guidelines to start your outline. And we'll look at an example coming from Nursing 723. So this assignment says, review the case study below and answer the related questions. Each response should be a minimum of 150 words. And then we've got 3 bullets here, each of which has multiple questions attached to it. Well, let's start with that first question. Well, how much do you actually have to write? And the instructions say each response, so each response to one of those sets of questions, should be a minimum of 150 words. Well, 150 words is about 2/3 of a double-spaced page. If you're using our APA course paper template, it has all the things that you need for an APA paper, like 1-inch margins, page numbers in the right place, double-spaced, using a 12-point font. And so if you're using the template, you can, with fair accuracy, estimate approximately how long a double-spaced page is going to be, and it's going to be around 250 words. So looking at this, all right, so the first bullet, it has what are 3 additional assessment questions you should consider asking this patient, and why would you ask these questions? All right, 150 words to answer that. So you could put all of this in one giant paragraph, but in general, you want your paragraphs to be around 5 to 7 sentences in length, and that each individual sentence normally be no more than 3 lines per sentence. It's a good general rule of thumb. It makes it a lot easier to follow the thread of ideas. It does look a little neater on the paper, and it helps your reader see when you're done discussing one thing so they can process it before they move on to the next one. So looking at this item here, what are 3 additional assessment questions you should consider asking this patient? Why would you ask these questions? Well, we'll start with a quick answer to each. The 3 additional assessment questions that should be considered are, and then you list number 1, number 2, number 3. And then the second part, these should be asked because, let me give you reasons for number 1, reasons for number 2, and reason for number 3. Now, this, depending on what you're answering and what you're trying to apply this to, they may be shorter or longer answers, but the common thread is that you are answering the questions in the prompt in the order that they're asked. You can always step back and come in with more details after that, but if you give them the big picture, then it'll be a lot easier to follow. As an example, if I was telling you a story and I start saying, so this story is about my great aunt Judy. You may or may not have heard of my great aunt Judy, but you're probably not terribly interested in her. But if I were to say, this is how through my great aunt Judy, I met George Clooney, the actor. Well, that's a different story because now we see where that's headed. And so by answering the questions and up front, and then coming back with a more detailed answer, this helps guide the reader through your argument. Similarly, if we're taking this next set of questions, what are 2 mind-body CAM therapies you would recommend to this patient? I would recommend this one and that one to this patient because of, and then give a short version of the main reasons. Follow it up with the detailed discussion of the reasons for the first one, detailed discussion of the reasons for the second one, and concluding sentence. There we go. And then remember when I talked about using the language of the prompt to clarify what you are responding to? Well, here, what other recommendations would you make? Well, if it's asking for recommendations, I want to use that word or something very close, like I also recommend, and then just list the stuff. I specifically recommend this because of, I'll give a short list of reasons. And then add one or two sentences on each one with citations to the literature. And that'll be about the 150 word max there. Now, when you are making your outline, you don't need to have all the answers, because when you're reading the questions, you can see, oh, I need a statement that responds to the question. I know that I'm going to have to list something here. Let me put a placeholder here so I know to go back and put that in later. And I'll continue on with the rest of my outlining. And then after I've done some reading or research, I can fill in all those placeholders. Just make sure that you actually do. I occasionally see an article in print where it has a comment that says, replace this or take this out. And you know it slipped through the process. You know, it happens, but let's try and avoid it on a paper you're getting graded on. All right, so about APA specific formatting guidelines. There are a lot of rules, but the core set, the ones that you'll use a lot, are actually not that time consuming to learn. So we'll cover them in a shorter form in the Intro to Grad Writing in APA style webinar that starts at 7 o'clock Central Time, and go into some more detail in Tuesday's webinar. You can also watch those immediately. We're going to use the rest of our time to talk about developing writing and planning habits that complement your schedule. Because as we discussed, nurses tend to be busy, and people who are working on their doctor of nursing practice program are usually working and their regular job at the same time. Sometimes they've increased their work while they're being a student. I had one who, for her own reasons, was very certain that she did not want to acquire any more debt. So she worked her way through her DNP program, working a lot of hours. I tend to work a lot, and she was beating me by a good 20 hours. And so the reason she came to me is that she wanted help on developing writing habits that would work with the schedule. And we found a way of carving things out and allowing her to set aside some time in her schedule in the morning when she was feeling fresh and could write, rather than try and do the writing in the evening when she was all burnt out, which is just one of those things that we want to acknowledge. If that's how we are, we want to work around or with that. On the other hand, if you don't write well in the morning, but you write well in the evening, make sure you arrange your schedule to do that. And a big part of this is creating a routine, where I strongly suggest that you first block off time in your calendar, and then you write yourself some specific achievable goals. It's all right to have long-term goals, but make sure you have some that can be achieved in the nearer future. Make sure that you build in breaks for yourself. Some people will work for 5 or 6 hours at a time. It is rarely as efficient as if they worked for an hour, took a short break, and came back and worked for another hour, took a break, etc. Breaks are refreshing. They're also good for our sanity, peace of mind, relaxation, and also there's a lot of subconscious processing that goes on in the brain, where if you're confronted with a situation and you don't entirely understand, your brain will keep working on that in the background. And so often people who are on a break will get a flash of inspiration that wouldn't have come to them if they stayed waiting around and trying to force that. Speaking of forcing, a lot of people have the opposite experience with external deadlines. In my experience, most people are better at getting material done on a schedule if there's someone or something that's holding them accountable. And so some people will set up the routine by saying, okay, I'm going to submit a draft to the Writing Center by Wednesday of each week. Awesome. If you end up having your appointment being on Thursday and submit your draft to us on Thursday, that's not a problem. We can work with you on that. But it's helpful to come up with a routine that includes regular deadlines that are external, that's governed by someone other than you, or you've agreed to give something to someone else, and use that to help keep yourself working regularly to make progress and be ready. A little bit more about outlines. So a good outline gives you a blueprint of what you need to research and write, including a rough idea of the level of detail that you need to do this in. They make it easier and faster to test ideas, and also to restructure your paper. And so this is very important if you're trying to get faculty feedback. It's a lot faster to give feedback on an outline. And if there are things that involve reorganizing, to move things around in the outline versus having to move around pages and paragraphs in your paper and have to rewrite large sections of them. So that blueprint gives you a kind of bird's eye of how things are organized, and you can look for a way to logically organize them and make things more clear. Now, the more specific and detailed your outline is, the easier and faster it is to do the research and writing. For example, if your outline says you need a supporting citation for a specific claim, well, you can go researching for exactly that thing. If it says it needs some evidence, you'll probably sit down and then you'll have to read a bit of the context to determine what evidence you need for this. It also allows you to sit down and quickly fill in some details, even if you only have just a few minutes at a time. One of my students worked very hard to develop this because when she was at work, there were people pressing buttons. And when she was home, there were small children running around and, if not physically pushing buttons, doing the metaphorical equivalent of that by screaming and knocking things over and things like that. And so her method involved developing a very detailed outline and having as much written as possible so that when she did the research, she could plug in the details. And so she was able to get a lot of productivity in very small segments that, even though they're individually small, taking part of your coffee break here, taking part of your lunch break there, and to work on moving forward. You can also put tasks related to your outline in your calendar, although I usually only do that for major milestones myself. Reading the assignment rubric in advance and reminding yourself that before you start writing is a great way to keep your papers on track. So I do recommend that before you do the week's reading, you create a draft outline based on the assignment rubric, and then you'll be looking for those details as you do the reading in the first place. Also, hopefully, some of the reading will make more sense when you know where it's heading. Go ahead and mark up your outline with notes, or on Word, you can use the highlighter tool, and create a list of things that you need to do, whether that's reading or to do library research on those topics. And as you do so, make sure that you are not repeating something that you can't reuse here. So let me put that another way. If you have a source that you need in one place, it might be useful at other times when you're discussing this part of the paper as well. For example, if I'm talking about home renovations, I might have in my introductory thing talking about how windows are expensive. Now, the source that I get for that comment might be one that I also use when I go to talking about building a house and putting windows in and the different effects of cost size on, the effects of shape on cost size. When you're writing, I do recommend that you follow a couple basic rules. First, be specific. Second, cite as you write. Now, it is important to spell check, and I strongly recommend reading your writing out loud. But if it's something like a name, which can be spelled many different ways, if you're citing as you write, you can look at the source and copy that directly in without wondering, okay, hold on, was that Smith with an I or Smith with a Y? Which can make it a lot harder to find things. You do want to avoid generalizations, to avoid metaphors and jargon. So generalization would be like, all insert this group are this way. All patients with diabetes present with X. They may or may not, but that is a rather sweeping generalization. And now it's, if you are writing text that seems poetic, there are some ways to formally and elegantly to describe things. But in APA style, keeping in mind that there are some culturally specific metaphors and a lot of terminology that only people in that business get, we want to avoid these when we can to communicate more clearly. We also want to use clear neutral verbs. I've had a number of students who are quite fond of using the verb pontificated. And I asked them, so literally the specific version of this verb means acting like the Pope. Is that what you intend here? And the answer was a very strong, no, shoot, that's not what I intended at all. And so it ended up being reworded to avoid that metaphor. We also want to avoid that verb. And so they ended up just using stated, which tells us, okay, it was communicated and doesn't have those other overtones of someone holier than thou, wearing white with a skull cap and other things that may or may not be part of your association. Transitions, especially with logical bridges, make sure you keep that audience in mind, and make sure that you use past tense for things that took place in the past, and present tense when you are describing an ongoing phenomenon. So, for example, only 5% of patients do not object to getting shots, Kawasaki 2017. We might actually have better data for that now that the COVID vaccinations are going as well as they are. But, this says, oh, okay, the phenomenon, as they understand it, about 5% patients do not object to this. And this is grounded in that claim. Now, it's a statement about how the world is now. Only 5% do not object. So that is in present tense because it's describing an ongoing phenomenon. However, if you're discussing the process by which it was discovered, like Kawasaki 2017 found that only 5%, well, that's talking about what Kawasaki did in the past. And so, of course, we use past tense there. Future tense doesn't get used a whole lot in the non-project based assignments. It can come up for some things like describing actions that you're planning to undertake, or writing about how you are awaiting IRB approval or something like that. An example, the intervention will be implemented at ABC Hospital in fall 2019. You also want to avoid anthropomorphism, which is when you give something inanimate human qualities. The study was designed to explore XYZ is not a problem because it clarifies why the study was created. But if you were to write, the study perceives several problems with ABC, well, the study's not alive. It's not actually seeing things. I mean, the researchers are doing the seeing and perceiving. So that's not so great here. An even better way of conveying this information is to stay who learned or did something. Like the research assistants conducting the study perceived several problems with ABC. Will you always want to give that level of detail? No. But if you are starting out in a paragraph and you're saying, oh, here's the big picture version, well, tell us who is working on it. The first example here would not be a problem if I'd earlier said, oh, I conducted all the research and explained who I am. Active and passive voice. Just to be clear, active voice and passive voice are both allowed in APA 7th edition. What APA style does is it discourages an overuse of passive voice because using passive voice too much or passive voice all the time makes it hard to tell who's actually doing things. Active voice makes clear who did what. Passive voice obscures that. For example, I created a survey instrument designed to measure XYZ. That's an example of active voice. The researchers used a STEM 5 questionnaire to collect data. Sturm and Wynn found that. Passive voice would be like the research was conducted over a 2-year period. Data were analyzed using a chi-squared test. Now, if I've already said, oh, I did all the statistical analysis, then there's no need to put an emphasis on me in this next sentence. It'll just be read a little bit more clearly if you use passive voice, data were analyzed. That's not a problem. It's about once you've established who's doing what's the clearest way to put the focus on the information? Like survey responses were coded using the study rubric. All right, so the most common and place where you'd be using I statements is when you're clarifying who did what. And then the most common reason that you'd be using passive voice is after you've clarified who did what. Like I conducted all data collection and processing, filled out surveys were coded. It's not that I coded the filled out surveys would be wrong, but if we have a whole paragraph with everything starting with I, it just feels like the focus is on you as the individual because you keep saying I did X, as opposed to putting the focus on the things that were done and found. You also often use passive voice to avoid anthropomorphism. We're going to wrap things up here because we need to switch gears to the next webinar. So I'll just again say that if you have RSVP'd for this webinar, or if you type your email address in the chat room, we're more than happy to share a copy of the slide deck and the recording, which includes a few additional slides that we didn't have time to get through today. With that, I'm just going to say that you want to make sure that you ground your work with scholarly sources as much as possible, in part because if you do so when you are writing your first few assignments, when you use things like your PICO question later, you'll be able to draw on those sources more. And with that, this concludes this webinar. And if you stick around for the hour, we'll be starting on the Intro to Graduate Writing and APA style webinar. Thank you.